self go be a boss. Amen. Amen. Everything you put your hand go up, your name go open doors. You self go be a boss. Amen. Amen. Sister, where one man receives until where they find begin. One day you go born twins. Amen. Amen. You're not wait on losing job. Landlord come they do like God. One day you go be landlord. Amen. Amen. Good news go locate you. Watch and see it no go take. If you believe it, say amen. No. Amen. Amen. Everything you put your hand go up. Your name go open doors. You self go be a boss. Amen. Amen. Everything you put your hand go up. Your name go open doors. You self go be a boss. Amen. Amen. Oh, oh, long life go follow you. Strangers go favor you. Great men go honor you. Amen. Amen. One day you go sign the check. Oh. You self go drive that Benz. Oh. This life go still make sense. Oh. Amen. Your children go make you proud. Oh. Bad people no go pull you down. No. One day you go run this town. No. Amen. Amen. You self go spray me money. Baby go call you honey. You self go host the party. Amen. Amen. Dangote go be your friend. Otedola go be your friend. Adenuga go be your guy. Amen. Amen. Elubelu go be your guy. Abdusamad go be my guy. Rabbi, you go be my guy. Amen. Amen. Your life no go end in shame. Your business go bring you gain. If you believe it, say amen. 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 Amen.
Are you seeking to live a healthier life and need a guide in achieving that? Then join Vic Riches on Solutions Clinic every Monday by 9:15 a.m. as we dive into a world of wellness, nutrition, fitness, and so much more. You also get to learn invaluable tips and advice to help you make informed choices on trending health topics and time-tested remedies from our guest doctors. For your health-related questions and more inquiries, please call 0810-812-8311. Take charge of your health journey today on Solutions Clinic every Monday by 9:15 a.m. Remember, a healthy life is your ticket to a wealthy life. Exclusive to Solutions 939. Is even a greater blessing. Unfortunately for some, aging comes with different levels of health challenges, one of which is dementia. Dementia is a complex neurological condition that primarily affects memory, thinking, and the ability to perform everyday activities. It is not a specific disease, but rather a set of symptoms caused by various underlying conditions. Dementia progressively impairs cognitive function, communication skills, and behavior, making it challenging for individuals to maintain independence and quality of life. However, every memory matters, even when they start to fade. Joining me this morning is Dr. Chukwuma Okoli, who would be, giving us more insight on dementia. Good morning to you, Doc. It's great to have you join us.
Thank you. Good morning.
Well, thank you once again.
You're welcome.
So I'll begin my conversation this morning with when do you suspect that someone is actually coming down with dementia?
Thank you. Yes, aging is a blessing. Now, while we sat out there, I remembered Sir Alex Ferguson and a few other coaches who retired in their 70s. Okay, and they were able to do everything the normal way. Okay, they were still able to handle pressure. They were able to train their team and make sure they win matches. He kept winning until he left United, and since he left, United has not regained its stability up till date. They just managed a few wins under other coaches, managed to win some cups, but not like going for the most coveted prize in football like that. And then he retired at a very old age, and he was able to do all. So the truth is, you age, yes, but while you age, you are still able to do your stuff normally. You're still able to handle risks. You're able to handle responsibilities. You're able to hold discussions. You dress and appear attractive. Okay, so what differentiates you from the younger generation is your age. Not in the fact that you are not able to reason alongside. Imagine you are being asked a question, what do you think we should eat this morning? And then you can't even process that. You are asked, okay, Dad, the choice of color, I want to combine. Do you think this shirt will go difficult coming through with it? At that point, you have to start asking, I hope dementia is not setting in.
So there's a difference between dementia and memory loss, because more often than not, we've seen that people would always think that they're similar.
Yes, they are similar, actually.
Okay.
The forgetfulness is what I'm talking about. Now, with age comes a little bit of all
So
this.
it's just terms. So there's
Yes.
forgetfulness,
Yes.
there's memory loss.
Yes, memory loss can be
Okay.
caused by a lot of things.
Okay.
Even stroke can cause it. Yes, nervous breakdown. A lot of things can cause memory loss. Aging too, to some extent. But one thing I always enjoy is that the aged are rich historians. Man, you want to have a good time, sit with your that you should wake up and have a shower. You see some people know they're quite old, and then they pass by you, either a smell of urine or a smell of not having a shower for days. They may not even remember that they've not even had a shower, or they don't even weeks ago. You told me what I did 10 years ago. Now you can't remember what just happened a week ago. I think at that point we should be worried.
So now that you've established that there's a difference between forgetfulness, memory loss, and dementia, is it safe to say that dementia is only particular to a certain age group? That's the age.
Yes.
So young people cannot come down with that.
Unless they have an ailment that damages the brain.
What kind of ailments would
We
that
have
be?
Hodgkin's, progera, and all that. And then some people could suffer, like the sickle cell could suffer stroke at an early age, and that could lead
Okay.
to stroke at an early age, and that could lead to,
Okay.
yes, that could lead to memory loss. And aside from those ailments and vascular diseases and brain tumors and neurism and all that, those things can actually affect the brain. And if it does, it could lead to memory loss and forgetfulness. But most times, it's something that coexists with aging. It's just that the motivation is absent. Okay, ability to communicate legibly is also lost. Then there comes this memory that we are talking about. It also is involved. So that's it.
Let's talk about the impact of dementia to caregivers and to the people dealing with it, because we see in movies where someone is very excited this minute, the next minute they're throwing tantrums.
Yes.
And it can be very, very discouraging
Yes.
to people who are giving care to them.
Yes. At this juncture, I want to say a big shout out to every caregiver out there, wherever you are. God bless you. They are doing a lot. I watched a video somewhere in Canada where a woman, I don't even know, probably that lady had been going through a lot. And this time around, she chose to put her phone in recording. And then this woman surfaced and then was throwing things at her. She was washing plate to the extent he spat on her.
Oh, I think I saw that video.
Really. That will tell you what caregivers go through. I've also witnessed an extreme of the positives where a man passed on and his two caregivers were wailing like babies. Like they literally have invested so much in the man that. And I was asking myself, but you're just an employee. But the bond had gone from employer to employee to a father-daughter relationship. Yes. So really, the caregivers have been trained professionally to endure everything. As a matter of fact, some people may not take food from their children, and it might be the caregiver who will successfully feed them. And even the caregiver will have a lot of difficulties in feeding. The next minute they tell you, I want to eat rice, and then you bring it and they tell you, who asked you to cook rice? And there we go. And the worst part of it is you're wasting my food plan. That's why sometimes it's best to say to have more than one plan. That's why sometimes it's best to say to have more than one caregiver, so that when day is beginning to change, you're like, okay, let's move to plan B. I think you should go do this, do that. Let me just stay with him or her until he or she is stable. So it takes a lot. You iron the clothes, you help them to have a shower and they dress, and you keep passing the compliments that makes them feel good. Oh, you're looking so fine today. Oh, thank you. You're looking so good today. I like this. Your geleo. Grandma. And then that is it. You just keep, giving your best